Hello, I'm John Grom, and welcome to the 64th Right and Left Discussion Forum. We hold our discussion forums twice monthly to provide an example of civil discussions, to demonstrate the value of keeping an open mind, and to show in a convincing manner the educational possibilities of having a sincere interest in the opinions of others. Today our panel will discuss the heroin epidemic in Medina County and elsewhere. It is a very broad problem. Today's panel, beginning on my left, is Dr. Natalie Sydorenko, writer, consultant, and educator. On her left is Jerry Ritzman, chairman of the board of Ritzman Natural Health Pharmacies. On his left is Patty Haskins, retired math teacher and current member of the Wadsworth City Council. And on her left is Bryan Laubaugh, president of R&B Financial Services. Natalie, glad you showed up today. I wouldn't have anybody to ask this question. You know, heroin and other opium derivatives have been both a benefit and a scourge to mankind ever since morphine was first distilled in 1804. What are your thoughts about heroin and other opiates' impact on today's culture?
Well, I've thought about that for a few days now since you told us about the question and how you wanted to open, and I kept trying to find a nuanced answer that would sound really brilliant, and I can't. I really just feel like the main word that permeates my mind about it is sadness. Sadness, and this is why. As a mother of two young daughters, I am sad for all the people, especially in my hometown of Wadsworth, that have lost children to heroin. Sad. I am sad for the parents of the young persons who are selling heroin, that their children are now going to be in jail, and that's what their life has become. 2 or 3 days ago, the Medina County Drug Task Force and Wadsworth Police worked in conjunction to arrest a 21-year-old man and a 17-year-old female, 17 years old, here in Wadsworth for selling heroin to an undercover officer.
Was that the Wadsworth Crossing area?
I believe so.
Yeah.
I believe so, yes.
It was.
And they had been wanting to do it for a while, and so they did. And then I think, what is the life of this 17-year-old girl now, and what took her to the point of being involved with selling heroin? They were both from Akron. I know that lots of people are coming into Akron and selling it here in Wadsworth. I'm sad because in 2008, I distinctly remember 2 students at the University of Akron saying to me when I complained of not being able to concentrate, "Oh, we'll get you Adderall. Oh, is your bladder still in pain? We can get you some Oxycontin." They could get me anything. They could get me any pills. And I thought, how is this possible? And I really thought it was going to go the way of pills. I didn't see heroin coming. But I feel that I should have seen heroin coming because of the amount of Oxycontin and oxycodone that was being prescribed for people in pain. I have a very close colleague at the university, and she has a family member who could not stop their addiction to painkillers and turned to heroin because of that. So I feel sad for the entire situation. I do also feel hopeful. When I went to the community consciousness raising discussion about heroin at the garage that was held in August or September, it was in September, there were 3 different testimonials of people that work directly with heroin addicts or who were former heroin addicts. They have all received help. They are all doing well. They are encouraging others. Their main concern was that there is nowhere for people to go for treatment in Medina County, especially not for poor people. One of the people who spoke has a family that's very well off. They were able to put tens of thousands of dollars into multiple rehabs for him. But if you don't have that, where will you end up? So we really need to find a way to not just arrest people that are selling heroin, but figure out why people are turning to heroin and how we can help them within our own county instead of shipping them out.
I think Jerry's going to give us some history about opiates that might shed some light on that, Natalie.
Yeah, and it is somewhat interesting how this heroin epidemic came about, and I think it was, if we go back to the 90s and the development of sustained release morphine that was used for chronic pain. prior to that, everything was immediate release and people would get big jolts of it. Physicians were reluctant to use that. But the sustained release morphine was developed, I believe, late 80s, early 90s, and so physicians became more comfortable with using that because they felt spreading out the dose over a 12 or 24-hour period would reduce the euphoria and reduce the potential of addiction. And I think it was in the early 90s, a physician in an East Coast hospital, acute care hospital, was asked the question, how many people on which opiates are used in your facility have become addicted over the last so many years? Well, there was a very specific question, and this was an acute care hospital. This physician wrote a response back. It was less than 2 paragraphs long, where he was he liked to look at data. He looked at the data over the last few years and said, in essence, said that less than 1% of the people on whom we've used opiates in this acute care setting have become addicted. And of course, this was short periods of time, post-operative until they were released. This letter, not a study, was published in the New England Journal of Medicine, and over the years it gained status where people would quote it as an extensive study, said that opiate use in chronic pain patients results in less than 1% addiction rate. And this is not at all what the individual said. But then in the 90s, a very close compound to morphine was developed, and that was oxycodone, which was first marketed as OxyContin, which was a sustained release form of that. And the manufacturer of OxyContin started to make some really outlandish claims that this sustained release form would not be addictive. It was actually in their literature that it was not addictive. They would promote it to physicians as such. And so its use just skyrocketed. Over the years, they found that the claims were not true or substantiated, or that they were backed up by any research, and people were getting addicted to OxyContin. Then in the last 3 to 5 or 6 years or so, one of the things that has really contributed then to the heroin explosion is that a lot of states, particularly in the Midwest, developed what in Ohio is called the Ohio Automated Prescription Reporting System, OARS, O-A-R-R-S. That's where physicians and pharmacists have a almost real-time database where if somebody brings a prescription or is at a physician's office and the physician is ready to prescribe an opiate, they can find out when is the last time over the last year that that patient has had a prescription for any opiate filled. And that's not only in Ohio, but we can get data from West Virginia, Kentucky, Michigan, all those other states, and particularly that's important for pharmacies and physicians close to the state line.
That's to prevent.
That's to prevent, you know, somebody if somebody
shopping.
comes to a pharmacy and they
Shopping.
and you can tell, well, no, this guy's been out in Lima, Ohio, and he just got the same prescription filled yesterday for a month's supply of stuff, and you can tell that. Or a physician can say, well, no, you were just to another physician and you just received this prescription for the same thing, and so that cut down a lot on how much prescription medication was available then for those individuals to sell on the street. And so one of the unintended consequences of OARS has been those people who are addicted can't get OxyContin, they can't get Vicodin as easily on the street, so they're going to heroin.
Which is also more affordable.
It is more affordable,
Right.
yes, because of the black tar, inexpensive heroin coming out of Mexico. So that's kind of the background on it in a real quick nutshell. So there's a lot of contributing factors to the heroin. But you're correct, Natalie. It's inexpensive. the marketing that they use, or the sales method that they're using for the black tar heroin, is almost a deliver to your door
Right.
type thing, where they call a central number and the guy shows up or meets you and sells you this inexpensive black tar heroin.
Would you say that the pharmaceutical companies, the advertising industry, healthcare industry in general, has an awful lot to account for in this epidemic?
Well, I believe so. Looking in retrospect, yes.
Yeah.
Yes, we do. And I think that some of the claims that were made were never substantiated. A lot of it was just inductive reasoning. The one thing that really, if we look back and think that there were physicians or people who actually worked for some of the manufacturers that were physicians that said, well, if somebody is truly in chronic pain, they can't become addicted to opiates because the pain cancels out the euphoria. Now, I don't know where they came up with that theory, but that's what was said in seminars and in promotional calls by manufacturers' reps. So,
Patty, what's your current thinking on this topic?
Well, it's interesting. When this first came to light, and this has been in the last year, the heroin epidemic is not new. It's not just coming out in 2015 as our big image. I mean, I retired from teaching in 2007, and at that time, I knew that heroin was a very common drug for people to go to. And it's as Jerry said, people started on using Vicodin or Percocet or oxycodone or Oxycontin, and I believe it's very chemically similar to
They're all opiates, what you just mentioned.
The heroin. So, and it was much cheaper. So they were able to, when they became addicted to that pain medication, to move on to the heroin. It is obviously a problem. From 2004 to 2014, the number of heroin deaths rose by 849%. That's monumental. 80% of all overdoses and deaths in Ohio are because of heroin. So it is the main concern that we have now. I think, though, we need to look at then, two areas on this. I think in some cases people think, well, if the police just were a little more active, it would all be taken care of. And as we've seen from our war on drugs, that doesn't always work. We do have to start with prevention, which works by education, which I know the schools are working very hard right now, adding new programs, as is the county. But also then, along with that, you have to look at treatment. The recidivism rate for heroin addicts is extremely high. Too many times, people, if they can find a treatment center, will go as an outpatient and will be treated, and then a couple weeks later are back doing heroin. They also have this unrealistic idea that, if I overdose, the police could give me Narcan and I'll be fine. And it's this, I won't really overdose because I can be treated and be, brought back.
There are cases where people have overdosed twice in one day and then brought back with Narcan.
Exactly. So, one of the things I know with the Medicare expansion in the state, one of the things that they tried to attack was the heroin epidemic and provide for treatment. The only problem is it only provides for outpatient treatment. It will not provide for inpatient treatment. And a sustained inpatient treatment center that also then provides support, group therapy, all sorts of behavioral objectives, is the only way that you can address the problem for those that have this addiction and can be treated.
And those people said exactly what you're saying, Patty. The people that testified, that shared their testimony at the garage, said, I failed miserably with outpatient treatment. It has to be longevity inpatient with follow-up
and
care.
not a 1 week or 2 week.
Right.
It just has to go on. And when they come out, it's even been stated that they'll need assistance with, finding a job, transportation, being able to get a license, all of these different things. Housing even, that affordable housing until they can get back on their feet. None of these things are being done in Medina County right now. As Natalie stated, we're woefully short in treatment facilities. And to prevent the overdoses, we need to start treating the patient. Now, as with any addiction, the bottom line, though, is it's going to come down to those individual addicts. They have to have the desire and want to stop using the drug. And until they, sometimes it's just like with alcoholism or any type of other narcotics addiction, until they hit their rock bottom, they're not going to seek help. But when they do seek help, we need to have the treatment facilities available to them.
Okay. I'm going to circle back to you in a minute about the politics of deciding on strategies.
Okay.
After we hear from Bryan and his brilliant.
I'm not sure I'm
And it's horrible cold.
that brilliant today. Sadly, in our extended family, we've had several situations. One resulted in an overdose and a death. And it seemed to me, as I observed those situations, that there was a start somewhere. There was an addictive behavior